Hello, I'm Rollins, and welcome to American Hospital and Healthcare Management. This is your gateway to the latest innovations in hospital innovations, healthcare technology, medical breakthroughs, and patient care strategies across America. Whether you're in hospital administration, clinical operations, healthcare information technology, or any corner of the healthcare ecosystem, stay informed and ahead of the curve with American Hospital and Healthcare Management. Anytime, anywhere. Want more? Subscribe now at www.americanhhm.com/subscribe and get the latest insights delivered straight to you.
Welcome everyone. I'm Sarah, and it's a real pleasure to have you with us on today's episode of the American Hospital and Healthcare Management podcast. In this session, we're exploring a topic that's shaping the future of medical diagnostics, how laboratory automation is driving efficiency, accuracy, and better patient outcomes. Joining me today is Mr. Dennis Odoi, a medical laboratory scientist, research scientist, and public health professional at Sonotech Medical and Diagnostic Center. Dennis has extensive hands-on experience in advancing laboratory practices and ensuring that technology serves both the professionals behind the bench and the patients who depend on precise results. His work offers a fascinating look into how innovation can simplify complex processes while maintaining the highest standards of care. In our conversation, we'll dive into his article titled Laboratory Automation and Efficiency, where Dennis shares how automation is changing the way laboratories operate, from reducing human error to improving turnaround times and overall productivity. So, let's get started. Dennis, welcome to the podcast. It's wonderful to have you here with us today.
Hello everyone, and a very warm welcome to all the listeners. I'm Dennis Odoi, a medical laboratory scientist, research scientist, and public health professional at Sonotech Medical and Diagnostic Center. Hi Sarah, it's a pleasure to be here with you today. Thank you so much for having me on the show. I've been following the American Hospital and Healthcare Management podcast, and I really appreciate how it brings together healthcare professionals who are passionate about progress and innovation. What I admire most about this platform is its focus on sharing ideas that drive real improvement, conversations that take complex topics and turn them into meaningful action within our healthcare systems. Today, I'm excited to talk about my article titled Laboratory Automation and Efficiency, which highlights how technology is reshaping laboratory medicine. In this piece, I explore how automation is not just about machines, it's about improving accuracy, speeding up diagnostic workflows, and empowering laboratory professionals to focus more on patient outcomes. We'll also look at how efficiency in the lab contributes to the overall quality of healthcare delivery, from timely diagnoses to better treatment decisions. I'm really looking forward to diving into this topic and sharing some insights that I hope will encourage healthcare teams to embrace innovation while maintaining precision and human connection in their work. Let's get started. Laboratories are the backbone of healthcare systems, providing critical diagnostic data that informs patient care decisions. With the increasing demand for rapid and accurate test results, laboratories face significant challenges, including managing high workloads, ensuring precision, and maintaining cost efficiency. Laboratory automation has emerged as a game changer in addressing these challenges, transforming the landscape of clinical diagnostics by enhancing efficiency, reducing human error, and optimizing workflows. Let's explore the evolution and impact of laboratory automation, its benefits, the different types of automated systems in clinical laboratories, and the future direction of this transformative technology. The discussion is grounded in my experience as a medical laboratory scientist, research scientist, and public health expert, combined with scientific evidence from the field. The evolution of laboratory automation. Laboratory automation has a long history, with its roots traced back to the mid-20th century. Early innovations focused on automating simple tasks, such as pipetting and mixing reagents, to reduce manual errors and increase throughput. However, it wasn't until the advent of advanced computing technology and robotics in the 1980s and 1990s that laboratory automation truly began to revolutionize the clinical laboratory setting. The automation systems of today are far more sophisticated, capable of performing complex workflows from specimen reception to result reporting with minimal human intervention. This includes pre-analytical, analytical, and post-analytical phases of testing, where automation ensures that sample handling is consistent and efficient throughout the process. Modern automated laboratories integrate multiple instruments into a cohesive, streamlined system, providing enhanced accuracy and reducing variability that can arise from manual handling. Types of laboratory automation systems. There are various levels of automation in clinical laboratories, each offering unique advantages, based on the laboratory's needs and resources. These systems can be broadly classified into two categories: total laboratory automation and modular automation. Total laboratory automation. TLA systems are comprehensive end-to-end solutions that automate all phases of the laboratory process, from sample receipt to result reporting. These systems include a combination of pre-analytical, analytical, and post-analytical automation to handle tasks such as sample sorting, centrifugation, aliquoting, testing, and data management. One example of TLA is the Siemens Healthineers Atelica solution, which offers automated workflow solutions that seamlessly integrate different laboratory disciplines. TLA systems also often include track-based technologies, where samples are transported between instruments on an automated conveyor belt, reducing the need for manual sample movement. TLA systems provide significant advantages, particularly in large, high-volume laboratories. They maximize efficiency, reduce turnaround time, and improve standardization across multiple testing platforms. However, they also come with high initial costs, requiring significant investment in infrastructure and training. Modular automation. Modular automation, on the other hand, allows laboratories to automate specific sections of their workflow based on their needs and budget. This flexibility enables laboratories to gradually incorporate automation, scaling up as required. For example, laboratories can begin by automating the pre-analytical phase, such as sample sorting and barcode labeling, and then progress to automating the analytical and post-analytical phases over time. One of the key advantages of modular automation is that it can be tailored to the size and scope of the laboratory. Smaller laboratories may not have the need or financial capacity for full TLA, but they can still benefit from automating critical steps to enhance efficiency and accuracy. The impact of laboratory automation on efficiency. Increased throughput and productivity. The primary driver of laboratory automation is the ability to handle high volumes of samples in a shorter time frame. Automated systems can process thousands of samples per day without experiencing fatigue or inconsistency, which is a common issue with manual handling. In high-volume clinical settings, such as hospitals and reference laboratories, this increased throughput is invaluable, allowing for faster diagnosis and treatment of patients. Improved accuracy and precision. Laboratory errors, particularly during the pre-analytical phase, can significantly affect patient outcomes. Errors such as sample mislabeling, incorrect sample handling, and manual pipetting inaccuracies can lead to false results, delayed diagnoses, or unnecessary repeat testing. Automation minimizes the risk of human error by ensuring that samples are consistently handled, labeled, and processed. Enhanced workflow integration. One of the most significant benefits of laboratory automation is the ability to integrate different aspects of the laboratory workflow into a cohesive system. Traditionally, laboratories relied on separate instruments for different tests, often requiring manual intervention to move samples from one machine to another. Automation bridges these gaps, allowing for seamless transitions between testing platforms. Automation systems can also be integrated with laboratory information systems, enabling automatic data entry and real-time result reporting. This integration reduces the need for manual data input, further minimizing the risk of transcription errors and speeding up the overall process. Cost effectiveness and resource optimization. While the initial investment in automation systems may be high, the long-term cost savings and resource optimization make them highly cost-effective. Automated systems reduce the need for manual labor, lowering staffing costs and allowing laboratory personnel to focus on more complex, value-added tasks. Additionally, automation systems often reduce reagent consumption through more precise pipetting and aliquoting, leading to further cost savings. Automation and the role of laboratory professionals. Contrary to concerns that automation may lead to a reduction in the need for laboratory personnel, automation actually enhances the role of laboratory professionals by allowing them to focus on more specialized tasks. Automated systems handle routine, repetitive tasks, freeing laboratory scientists and technicians to engage in more complex problem-solving, quality control, and interpretation of results. In addition, laboratory personnel are still essential for maintaining and troubleshooting automated systems, validating test results, and ensuring that the systems are functioning optimally. As automation becomes more widespread, the role of the laboratory professional is shifting towards that of an operator and manager of sophisticated technologies, requiring continuous training and education. Challenges and considerations. While the benefits of laboratory automation are clear, there are challenges that must be considered, particularly for laboratories transitioning to automated systems. Some of the key challenges include high initial investment. The cost of purchasing and implementing automated systems can be a significant barrier, particularly for smaller laboratories with limited budgets. Laboratories must carefully assess the return on investment and consider long-term savings in labor and reagent costs when evaluating automation systems. System downtime and maintenance. Automated systems, like any technology, are subject to technical issues and breakdowns. Laboratories must have contingency plans in place to address system downtime, including trained personnel who can troubleshoot and repair issues promptly. Regular maintenance is essential to ensure that the systems continue to operate efficiently. Training and skill development. Implementing laboratory automation requires personnel to acquire new skills in operating and maintaining automated systems. Ongoing training is critical to ensure that laboratory staff are proficient in using these technologies and can adapt to evolving advancements in automation. The future of laboratory automation. Looking ahead, the future of laboratory automation is promising, with ongoing advancements expected to further enhance efficiency and diagnostic accuracy. Emerging technologies, such as artificial intelligence, AI, and machine learning, are poised to play a key role in laboratory automation. These technologies can be integrated into automated systems to optimize workflows, predict maintenance needs, and enhance data analysis, ultimately improving diagnostic capabilities. Moreover, the trend towards personalized medicine and precision diagnostics will drive the need for more sophisticated automation systems that can handle complex molecular and genetic testing. As laboratory automation continues to evolve, it will become an indispensable tool in improving patient care and advancing healthcare outcomes. Laboratory automation is a transformative technology that has revolutionized clinical diagnostics by improving efficiency, accuracy, and workflow integration. As healthcare demands continue to grow, the adoption of automation will be critical in meeting the increasing need for rapid and reliable test results. For laboratory professionals, automation offers an opportunity to enhance their roles, focusing on more specialized and value-added tasks. While challenges remain, the benefits of automation far outweigh the costs, making it a worthwhile investment for laboratories of all sizes. By embracing automation, laboratories can optimize their processes, improve patient care, and contribute to the overall efficiency of the healthcare system.
That was such an insightful and thoughtful discussion, Dennis. Your perspective on how automation is enhancing laboratory operations truly highlights the balance between technology, precision, and human expertise in modern diagnostics. Thank you so much, Dennis, for sharing your knowledge and experience with us today. It's been a real pleasure exploring your article, Laboratory Automation and Efficiency, and understanding how innovation continues to redefine the efficiency and reliability of healthcare laboratories. What really stands out from our conversation is your emphasis on teamwork and adaptability, how technology doesn't replace professionals, but rather supports them to deliver faster, more accurate, and more meaningful outcomes for patients. I'm sure our listeners will take away some valuable insights about how efficiency and automation go hand in hand to improve both workflow and patient care. Once again, Dennis, thank you for being part of this meaningful conversation on the American Hospital and Healthcare Management podcast. Your message reminds us that progress in healthcare isn't just about adopting new tools. It's about combining innovation with purpose, precision, and compassion. And to all our listeners, thank you for joining us today. Stay inspired, keep exploring new possibilities, and continue contributing to the future of smarter, more efficient healthcare. Until next time, this is Sarah, signing off from the American HHM platform. Take care, stay motivated, and we'll see you in the next episode.